Cat scratch disease or CSD is an infectious disease that most often results from a scratch or bite of a cat, sometimes from dog scratch, which is a subacute regional lymphadenitis caused most frequently by bacteria called Bartonella hanseatii. It is the most common cause of chronic lymphadenitis that persists for more than 3 weeks. Bartonella hanseatii can be cultured from the blood of healthy cats. It means you can get the disease even from healthy cat. Symptoms typically begin within 3 to 14 days following infection. 3 to 5 mm or more red papules develop at the site of cutaneous inoculation, often reflecting a linear cat scratch. These lesions are often overlooked because of their small size, but are found at least 65% of patients when careful examination is performed. Lymphadenopathy is generally evident within 1 to 4 weeks. Chronic regional lymphadenitis is the hallmark, commonly present as tender, swollen lymph nodes near the site of the inoculating bite or scratch or on the neck, and is usually limited to one side. This condition is referred to as regional lymphadenopathy and occurs 1 to 3 weeks after inoculation. Nodes involved are usually tender and have overlying erythema, but without cellulitis. They usually range between 1 and 5 cm in size, although they can become much larger. From 10 to 40% eventually suppurate. The duration of enlargement is usually 1 to 2 months, with persistence after 1 year in rare cases. Fever occurs in approximately 30% of the patients and usually 38 to 39 degrees Celsius. Other non-specific symptoms including malaise, anorexia, fatigue, and headache affect less than 1/3 of patients. Transient rashes, which may occur in approximately 5% of patients, are mainly truncal maculopapular rashes. Erythema nodosum, erythema multiforme, and erythema annular are also reported. The most common ocular presentations of CSD is paranode oculograndular syndrome, which is unilateral conjunctivitis followed by preauricular lymphadenopathy and occurs in 5% of patients with CSD. Direct eye inoculation as a result of rubbing with the hands after cat contact is presumed mode of spread. The diagnosis are mostly symptoms and history. The best diagnostic method available is polymerase chain reaction, which has a sensitivity of 43 to 76% and a specificity of 100% in one study. The prevention: cat scratch disease can be primarily prevented by taking flea control measures and washing hands after handling a cat or cat feces. Since cats are mostly exposed to fleas when they are outside, keeping cats inside can help prevent infestation. Most healthy people clear the infection without treatment, but in 5 to 14% of individuals, the organisms disseminate and infect the liver, spleen, eye, or central nervous system. The preferred antibiotic for treatment is azithromycin, since this agent is the only one studied in a randomized controlled study. Azithromycin is preferentially used in pregnancy to avoid the teratogenic side effects of doxycycline. However, doxycycline is referred to treat B. hanseatii infections with optic neuritis due to its ability to adequately penetrate the tissues of the eye and central nervous system. Cat scratch disease has a worldwide distribution, but it is non-reportable disease in humans, so public health data on this disease are inadequate.